আসসালামু আলাইকুম। আমি একজন মেডিকেল স্টুডেন্ট। আপনার উপর একটু পরীক্ষা করব। আপনার কিছু সমস্যা হবে না, কিছু সমস্যা হলে আমাকে জানাবেন, ঠিক আছে?
ঠিক আছে।
আপনি কি রাজি?
হ্যাঁ, রাজি।
And after that, firstly we should go for the inspection of the patient, and in inspection of the patient there should be proper exposure of the patient. And for proper exposure, if you are doing the lower limb examination, uh, basically or ideally you should have all the lower limb exposed, but due to some privacy, maintaining the privacy of the patient, if he is wearing a lungi, then you should expose up to the mid thigh in a way that his private parts are not exposed. একটু উপরে তুলে ফেলেন। হ্যাঁ। And in this way we can expose our patients, and after that for inspection the position should be like both the legs should be properly straight, and we should inspect both the legs, and in inspection we should like and for the fasciculation with the two fingers we should tap on the mid thigh. So on inspection, what are the findings that we are looking for? Basically on inspection we are looking for if there is any asymmetry between the two legs, any deformity that are located in the legs, and any visible muscle wasting of the legs, and if there is any scar mark anywhere in the legs. Also we should look for the hair distribution and pigmentation. That are the general inspection findings. And after the inspection, we should go for the palpation. And in palpation, firstly we should look for the bulk of the muscle, and bulk of the muscle should be evaluated on two sides. That is, firstly, it should be in the mid thigh, and for mid thigh we should look for the. Firstly, we should look for the tibial. We should locate the tibial tuberosity, and from tibial tuberosity, at a certain fixed point, we should mark. We should have mark, and which will correspond to the maximum muscle width, and through that, with the centimeter, with the measuring tape, and with centimeter, we should measure the bulk of the muscle, and in bulk of the muscle, generally it should be symmetrical. It's 35 centimeter. Same should be done on the opposite side with the tibial tuberosity, and then on the mid thigh, and also we should look for like measuring tape. 35 it's good, and in the leg also for the tibial tuberosity, and for the maximum bulk of the muscle where it is. So from the tibial tuberosity 5 centimeters below, we should mark and have a measuring tape. So it's 29 centimeter here. Same with the opposite side. And after that we should go for the tone of the muscles, and in tone of the muscles we have three methods, and firstly it's the rolling method. So in rolling method, focus here. In rolling method, just like how you do roti in that way. And other is the passive movement of the joints. Firstly, for the hip joint, there should be like circumduction, and then there should be like extension and flexion at the knee joint, and in the ankle joint it should be like extension, flexion, inversion, and then for the head it should be like extension, flexion, extension, and then inversion, exversion. Same Same with same with the other leg as well. Flexion, extension, and then in ankle also flexion, extension, inversion, and recto as well. Flexion, extension, and inversion. Other method to know about the tone of the muscle is like fall from the height. For that we should instruct the patient that বাবা আমি একটু নিচে আপনার পাটা নিচে
হ্যাঁ ঠিক আছে ঠিক আছে ঠিক আছে
আমি নিচে আমার হাত আছে
আচ্ছা
নিচে নিচে
ছেড়ে দেবেন
ছেড়ে দেবেন
ছেড়ে দেবেন
ছেড়ে দেবেন These are the how will you evaluate the tone of the muscle. After that we have looked for the tone of the muscle. We should look for the power of the muscles. And for the power of the muscles, we have the MRC reading for the power of the muscles. And in that, we should instruct the patient in a way that he can perform it by himself. বাবা আপনি একটু ভাঁজ না করে দুই পা ঠিক সাথে উপরে উঠুন So, since he is able to do that, then we should know that power of the muscle is 3. If he is not able to do that, we should know that power of the muscle is less than 3. And if the power of the muscle is less than 3, then we should ask for the side-to-side movement. Only if he is not able to lift the legs. So, just for demonstrating, since he is able to lift the legs, so his power is more than 3. Just in case, if he is not able to lift the legs, or any patient who is not able to lift his both legs according to the instruction, so for them, we should instruct that do the side-to-side movement. একটু ইপাশে আর দিয়ে দেন so he is able to do side-to-side movement, so his power will be good. And also if he is not able to do side-to-side movement, then we should look for the movement of the great toe, that is flickering movement. একটু নড়াচড়া করেন শুধু এটা okay. So he is able to do the flickering movement. And for the flickering movement, his power will be 1. And if he is not completely able to perform any such movement according to instruction, his MRC grading for the power of the muscle will be 1. Will be 0. So that is complete paralysis. And since he is able to do, he is able to lift against the gravity. So now we will look for the power of the individual muscle that is against the resistance. So for that we will instruct the patient with the both hands in the flex in the upper thigh. So mama একটু আমার হাতের দিকে চাপ দিবেন, হ্যাঁ বাইরের দিকে চাপ দিবেন, ভিতরের দিকে চাপ দিবেন, নিচের দিকে চাপ দিবেন. So and now for the legs, আমার আপনি একটু পাটা একটু বাইরের দিকে নিয়ে যান, ভিতরের দিকে নিয়ে চেষ্টা করবেন, বাইরের দিকে নিয়ে যাওয়ার চেষ্টা করবেন, ভিতরের দিকে নিয়ে যান, বাইরের দিকে নিয়ে যাওয়ার চেষ্টা করবেন, ভিতরের দিকে, বাইরের দিকে, ভিতরে, বাইরে, আবার হাতে চাপ দেন, বাইরে বাইরে বাইরে, ভিতরে, বাইরে, ভিতরে, ভিতরে, বাইরে. And so I think his power is, according to the MRC grading, his power will be 5. And after doing the power of the muscle, we should look for the deep tendon reflexes. While performing the deep tendon reflexes, firstly we should go for the knees up. And in knees up, there is the proper positioning for the knees up, and it should be semi-flexed, and his heel should touch the bed of the bed, and your hand should be supporting the your hand should be supporting his knee joint. And now focus. So going.
Yeah, started.
And then after that, you should feel the patellar tendon. You should locate the patellar tendon first. So patellar tendon should be above the tibial tuberosity, and then while hitting the patellar tendon, your eye should be in the quadriceps muscles. So you can see it's like exaggerated knees are present. Same should be done for the opposite leg as well. Positioning and then localization of the patellar tendon, and your eye should be focused in the quadriceps muscles. So you can see that his ankle jerk is exaggerated. And now for the knee jerk is exaggerated, and now for the ankle jerk, it should also be the proper positioning, and then you should feel the tendon over here, tendon Achilles, and your hand should support his foot, and not with this. It should be with this. You with the opposite side of the clinical hammer, that you, while performing the ankle jerk, you should hit with the opposite side of the clinical hammer, and then also you should look for the calf muscles. While hitting, you should look for the calf muscles. Same goes with come on, same should be done with like opposite leg as well. You should look for the calf muscles. It's exaggerated. And after performing the two tendon reflexes, knee jerk and ankle jerk, there should also be the plantar reflex should also be done. And for that, you always need to carry your one key with you to perform the plantar reflex. And for that, on the lateral side of the scene, on the lateral side of the scene of the leg, you should from downward to upward. No, and sorry. Firstly, you should inform to the patient that while performing, you will feel a little bit of pain, so no need to worry about that. আপনি একটু পাইতে পারেন, সমস্যা নেই। Then you should perform like this, and you should look for the great toe and the fanning out of the other toes. Same should be done with the opposite leg as well. Go from the downward and through the lateral side and come up to the great toe. So he has got flexor response. In one examination that is remaining is the clonus, which is very necessary to perform in case of to find out whether it is upper motor neuron lesions or the lower motor neuron lesions. For that, there should be the proper positioning of the patient. And in the proper positioning of the, firstly, I will demonstrate the ankle clonus. And in ankle clonus, the leg of the patient, that is the hip and knee, it should be in the 90-degree position, and then you should ensure that the patient is in relaxed position so that clonus can be elicited very well. And by considering, by making the position of the patient in 90 degrees, that is hip and knee, then you should like first relax the patient by supporting the back of the sole of the foot with this hand and keeping this here, and then you should like, or you can keep it here as well, and then you should like relax in a manner so that the patient will feel relaxed, and then after doing 2 to 3 times, then suddenly you should do like this, and then he will have like shivering here. You can feel there will be rapid movement of the legs, and it indicates that the clonus is present, which will indicate the upper motor neuron lesions. And another one is remaining is the patellar clonus. For the patellar clonus, the legs should be in anatomical position, and you should have to feel the patella, and with the left hand from upward to downward, you should firstly relax, and with the opposite hand, that is right hand, with from the upward to downwards, you should like do like this, And if it is present, then you can say same jerky movement, like rapid oscillar movement will be seen here, which will indicate that the patellar clonus is present. Then in this patient it is absent, but if there will be upper motor neuron lesions, then you can see there will be jerky movement over here. And if what I have said is that if the ankle jerk and the knee jerk are absent while you perform the maneuver, and then don't say to the examiner that knee jerk and ankle jerk are absent while performing once. So to confirm that it is totally absent, you need to perform the generic maneuver. For that, you should need to inform the patient that you should hold your hand like this, or you can do it by like saying clench your teeth. These are the generic maneuver. I'll show you one. Like বাবা আপনি হাতটা এইভাবে করেন, হ্যাঁ এইভাবে করেন আর টান দিয়ে রাখ না নিচে, হ্যাঁ ঢুকতে লাগে, এইভাবে করেন, টান দেন। আর আমি যখন 1 2 3 বললে আপনি আবার বেশি করে টান দিয়ে দিবেন। 1 2 3 বেশি করে টান দেন। It's exaggerated. This is the generic maneuver. And other one is remaining while performing the lower motor neuron examination is of the lower limb will be like coordination, Hilsin test. So firstly you should inform the patient that you should took your V along the length of the scene. বাবা আপনি আমি যেরকম করে দিছি না, এখান থেকে এখন পর্যন্ত নিজেরা পা দিয়ে নিজেরা এখানে করবেন, করেন তো। ই পা দিয়ে আবার করেন তো এখানে, হ্যাঁ নিচে 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 নাও। So its coordination is also intact. And other examination that we need to perform, but generally in the examination they don't ask you to do so, but you should say to the examiner that to complete my examination I would like to perform the rhombus sign and the gait, and I would like to look for the gait of the patient, but it is generally not done. So it's like our examination will be completed there, but while completing the examination you should like have the clothes where it was in the original position, and then you should like say thank you or dhanyabad to the patient, so that it increases your like efficiency of the while performing the examination. বাবা আপনাকে অনেক অনেক ধন্যবাদ, আপনি আমাকে সাহায্য করেছেন, অনেক অনেক ধন্যবাদ। So in this way you will complete your examination. Thank you.